Okay, welcome everyone. Thanks for joining us today. I do have a few little reminders to start. Please sign up for Basecamp if you haven't already, and feel free to share the Basecamp invitations with your colleagues. That's where we post the webinars, our meeting notes, and other helpful materials and documents about telegenetics. If you haven't received an invitation to Basecamp or have any questions, feel free to contact me or the NYMAC staff. A quick update for the group. There was recently a telegenetics meet and greet at the ACMG meeting. I hope some of you were able to attend that. And a number of telegenetics providers from NYMAC attended the telehealth summit put on by MATRC in Virginia last week, which included a pre-summit session on telegenetics. It was really wonderful to see genetics so well represented, and all of those of us in attendance learned a lot from the other telehealth experts there. Looking ahead, the next webinar will be in May on training for students and providers in telegenetics, and we will be in touch on a date for that. Today, we're going to talk about telehealth technology options. We're lucky to be joined by two of MATRC's consultative service partners. Jay Ostrowski is the CEO of Behavioral Health Innovation and is the Director of Product and Business Development for the National Board of Certified Counselors. Mr. Ostrowski helps mental health programs of all sizes develop regional and national online telemental health services. He's a licensed professional counselor, supervisor, and often helps programs with service creation, choosing HIPAA-compliant technology, creating referral sources, reimbursement, online practice management, and training online clinical providers. And also Mike Patterson, who is the CEO of Two Tier Technologies. Mr. Patterson brings over 30 years of experience in healthcare technology to the team. He served as the technical manager for the University of Virginia Office of Telemedicine, an industry pioneer and one of the largest and most successful telemedicine programs in the country. Through thousands of clinical encounters, Mike has facilitated telehealth at every level, including needs assessment and hardware and software evaluation. As usual, we encourage people to share their own experiences and ask lots of questions. Thank you, Mike and Jay, for being here, and we look forward to hearing from you.
Hey, thank you, Alyssa. I really appreciate it. Yeah, the telehealth technology is a passion of mine and has been, and so I'm just gonna jump right in because we could talk for hours and we don't have that time allotted. It's an exciting time to be in telehealth technology. It's an exciting time to just be a part of telehealth. There's so many vendors out there that right now I liken it to the Wild West and the gold rush. There's a vendor of the day popping on board, and while there are a lot of great vendors out there, there's so many options. So which flavor do you choose? And so when I'm sitting down with clients, there's a couple of things I want to know up front before I get into technology, because if we don't have these in place, it's not going to work. And the first thing I want to know is, do we have buy-in from all the key stakeholders? And the stakeholders, the key stakeholders that I'm looking for, I'm looking for a clinical stakeholder, a physician or a clinician that can speak doctor speak, healthcare speak, and that they're on board and they're going to be a champion for doing the clinical encounters. The next person would be the financial person who handles the checkbook. In a large organization, maybe a CFO. In a small organization, all three of these folks may be wrapped up into one that's doing it all. But I need someone that handles the financial end of it, and then the operational person, the boots on the ground. Failure's not an option. Just the guy or gal that's going to get it done on a daily basis. And once those three people are into place, we can start talking telemedicine, telehealth a little bit. I liken it to a three-legged stool. If either one or any of those are missing, the stool's not going to stand. And then the next.
This could be challenging too if you're just starting out a program, because you may want to pitch it to these senior staff, your bosses, if you will, and you might need to gather some information up front. So we can help you do that up front if you're just starting out and you need to kind of put together kind of almost a sales package of why you should do this and what the options are, and that it's not going to blow the budget. But once you get serious about doing this, these are the people that you really have to have involved, or it really won't be successful.
Thanks, Jay. That's a great point, because I have I've seen a number of programs start off with one person that's excited about telehealth, but they haven't communicated it back, and when the rubber meets the road, they don't have enough buy-in. And then the next question is, where will the equipment be used? You know, how are you going to use it? Are you going to be using it in an exam room, or an office setting, or a home setting, or a combination of the above? In an exam room, is it going to be a desktop, or are you going to have multiple exam rooms? Maybe you need a cart. Maybe a desktop will work. So with that in mind, just think through exactly where you want to use the equipment, and start thinking from there. And then mixing it up a little bit, maybe going from clinic to clinic, clinic to corporation or a school, any combination of any of these. Jay, you want to add some to that?
Yeah. So when you're looking at your services, the easiest thing to start out with, of course, is clinic to clinic, and mostly because of the infrastructure that's at each site. But some people might want to, do different combinations. That Mike and I both have experienced that. If you've seen one telehealth or telegenetics program, you've seen just one. While they share a lot of similarities, every single program we found to be just a little bit different, because there's different infrastructure, different people in place, different objectives. But these are all options that can be done in a HIPAA secure way. So if you're looking at maybe having a provider at home that provides services to another person at that person's home or that patient's home, that's an option. Some of it has to do with funding. If you're to Medicaid, Medicare, they may require that it's at an approved site before you start services. So these are the kinds of things that we could talk you through. And then the site that you pick will have some requirements for that site that will lead you towards what kind of software to use, what the requirements will be for that software. And we can do some business planning and workflow planning to make sure everything is HIPAA secure. So Mike, you want to talk about functions?
Sure. And then, pardon me.
Are you going to take that one?
Yeah, take it, then I'll comment.
Sure. So another thing to think about when you're picking software or your systems is to think about what else will you be doing with this. So we often laser in telehealth with video or some kind of devices, but there's a lot that goes into ramping up to that. Like if you're going to do this between clinics, you want to be able to share documents, maybe insurance paperwork, maybe some kind of forms or history. These are things that can be gathered through a patient portal or through one of the new software systems that you choose. Maybe it's that you already have access to an EHR and you don't really need that. But if you don't, you need some kind of way of obtaining that. So you want to kind of map out all the things you're going to need at each end to make sure that you have that as part of your requirements building, so that when you pick the software, that everything meets these requirements. So again, some of these might be, do you collect a copay through your system? Do you schedule, or do you allow your patient to schedule? How do you get your referrals? You want your referrals to come through a secure system too. So, and do you need like 3 or 4 people logging in from different locations? If you're counseling a couple, the couple could be at 2 different locations, and you might want to make sure that you can have both of them log in at the session time in a secure way.
Yeah, and with workflow, I was going to comment that if you're using a workstation at a desktop, you have the software there and you may be able to share documents and do everything you need to do. If you're using a cart in an exam room, that cart may be just a video conferencing tool only with some peripherals or non-peripherals. So you have to think about workflow for your staff. Would I need to put a workstation in the room with the cart? Well, that may or may not make sense if the cart's moving from room to room, or I'm going to have my staff running in and out of the room.
Exactly. Yeah, so determining kind of the whole system of how do you register patients or see their histories or maybe their lab work or the results from their lab work. Do you need to give them a copy of that? Do they need to have a portal where they can download that and save that to their own desktop device. So these are just things, again, you want to think through what your requirements are before you start shopping. Because once you start shopping, you get a blizzard of marketing, and often pushy salespeople want you to start buying if you haven't experienced that already. It's wonderful. So integration points. So we want to look at, are you, as part of this, are you going to be integrating with another system? And I just went too far. I think you need a license to drive this sometimes, don't you? So the integration point, will you be connecting with somebody else's EHR? Or is there existing equipment at the other site that you're connecting with? So if they already have a camera at another clinic, you're going to want to identify that equipment and make sure that you can tie into that. There's some, we'll talk more about that in a minute, but there's some that you can and some that you can't. Also, do you need to connect to some kind of network within your existing hospital or organization? And are there any restrictions or requirements there? You want to just find out from the IT staff, if they might already have a system that you could use or reuse. And then, do you need connectivity to EHRs? There's some systems that allow you to tie into your existing EHR or be kind of like a bridge between two EHRs that don't even communicate together. So there are many options for the integration points. You just want to think through that. And then the next thing I wanted to cover is to look at your scope. And Mike and I have talked about this at length. But Mike, do you want to talk about the budget?
Sure. Yeah. Is it a Tesla or a Nissan Leaf or a beer or champagne budget? It's that's actually why you need the financial person there. And I would suggest that you start talking Tesla to the financial person. I'm kind of joking a little bit, but not really. And then maybe come into a happy compromise down the road. But budget's important, and in doing your exams, are you going to need peripherals? Are you going to need a stethoscope or an otoscope or some type of patient camera? And how will that integrate in your workflow, and how will you test it? Network engineering, IT support, and vendor support, depending on the scope of your equipment, depending on if it's a simple software-based solution, you may not need a lot of IT or tech support. It may just work just fine. But if it's carts or desktops or a combination, there may be a little more to do there. So beware.
Mike, if I could back the bus up a minute. So on this budget thing, this is probably going to be, like a dark closet. People are going, I don't know what to put in this budget. And we could do an hour seminar each one of these topics that are bulleted here. Oh. But when someone's new to budgeting this kind of stuff, I think about you really got to sell this to financial people. And one way to do that is to show, what's the current, the state of the union, if you will. Are you missing business as a company, or you're not able to get business because of a certain thing, or is it costing a lot to travel? Or are you losing a provider and this is a way to outsource and add a provider? There are lots of ways to kind of sell this idea. Or is this a new line of business where the company will get revenue from this model that they weren't getting before? How would you, on the cash positive side of things, how would you recommend they go about budgeting for this?
Yeah, that's a great point, because one of the first things I hear when I walk in is, what's my ROI, or how much is this going to save me? And a few years back, it was difficult to come up with an ROI. Not so much anymore. I can tell you some projects I'm working on now with sniff telemedicine. I can show you with transports quickly how to pay for equipment, just saving just a few transports. And I guess we ought to back up too, because Jay and I have talked about this a lot. Everyone uses this buzzword telehealth and the other one telemedicine, and what we're doing, it's just a continuum of care. It's just another part of it's just another tool in the tool chest for delivering health care. And we budget for CT scanners and all sorts of things like that. I'm telling you, telehealth is budget dust when you look at the ROI and some of the savings, if done properly, if implemented properly. And then back to the vendor support, IT support, and we'll get into this a little more too, but your vendor support can be key to your success as well. Once you've interviewed your vendor and you've selected a good vendor and you've got a good partnership, that can mean everything. But when you're talking to your vendor and when you're building your program, you have to look for the hidden costs that are not always thrown out there up front. You know, things like training. Will I need specialized training? Well, you know, a software solution may be pretty simple. It may be intuitive. You may not take a lot of ramping up time. A cart with peripherals, you know, I don't know. It may take a lot more time. It may need some specialized training. I teach a course in teleetiquette, and which is, I think, is huge for carts, software, whatever you're doing, because you can also lose your telehealth encounter. And I know I'm speaking to a lot of clinicians that already know this, but I find that telehealth training for etiquette in a video conference is more important than it is face-to-face in an actual face-to-face encounter.
Yeah, I would agree with that. You know, the hard part of this is people don't know what they don't know, and that's why, you know, people are watching this this training now, and you know, it's simple to do what we do through telehealth, but there are a lot of kind of one-off scenarios that we usually like to cover. That you just, if you hear it once, it's kind of like, oh, that's a no-brainer, but I didn't encounter that problem, so I didn't think to make that a policy, but it needs to be a policy. And some of the things, you know, you don't notice yourself on camera. And we joke about Dr. Forehead. You know, so once you have a clinician that's not, that thinks they know what they're doing, it's hard to coach them later on to, you know, have the proper, you know, framing and to make sure that their system is running smoothly before they start, and if their background looks good, and, you know, to set some standards basically as protocol. And when you're looking at, you know, training, you're also kind of setting policy for your company. So it might just be you starting this, but you also need to start a program that lives on without you. The way I found that the best way to move up in the world is to make it where someone can take my place so I can go on and do bigger and better things. So when you're making this you know, new program, you want to write some policies and procedures and just some standards so that the people around you know that you got this, that you have things in place. So when you hear about training from different companies and vendors, there really is a need for training. Even though it's very simple, training is really equivalent to hand-holding. You want to have someone that's going to answer your questions and be there for you if you have something new go on. And it'll give you a lot more confidence in doing this. Wouldn't you agree, Mike?
Yeah, absolutely. And along with training, you put in a testing, you know, a simple testing procedures with your equipment so that you test the video and audio prior to encounters. So it's simple, it's ongoing, but I liken it to a crash cart. You check off to make sure all the tools are there every day.
It's a lot like driving. Once you start driving and you're driving for a while, it's no big deal. But when you first start, it's a little scary. Not because it's difficult, but just because it's new.
Absolutely. It's also new when it's also a little scary when you're training new telehealth folks, because this takes me back to training my teenage daughters, and I'm in the passenger side holding the handle, knowing that everything's going to be fine, but I wasn't convinced a couple of times. But the other thing I would caution you about to look at is annual maintenance subscriptions and licensing fees and any other hidden costs that may go. I know with the larger systems, the Ciscos, the Polycoms, the videos, It's been my experience that ongoing maintenance fees are about 10 to 12% of the purchase price. That's not always true, but that's just been what I've observed, somewhere in that. So if you've, if you've thrown $25,000 into a machine or several machines, you may be paying $2,500 a year subscription fee. And I will say that most vendors, if you don't go with annual subscriptions, you can't get the software upgrades. So for some of the larger telehealth vendors, so you won't get the security patches.
Yeah, and that's actually critical because it's required to be HIPAA compliant to have those patches in place and to be recording those. So there are many ways to do telehealth on the cheap, but you never want to. You need to pick a system that you can pay for, that maintenance and that patching, so that you don't put your company at risk.
Right. Well, when it comes to HIPAA, you can start telehealth on the cheap, but HIPAA penalties are pretty high. Well, I think we're going to get to that in the next slide or two.
Well, yeah, that kind of brings us to, that's a great lead-in. So HIPAA security is something that I've specialized in for quite a long time, mainly because my background as a counselor and was in making technologies for telemental health. So what's important for us to realize is that HIPAA is a lot more extensive than most people realize. So I made a little color continuum to kind of think about what HIPAA security looks like, now with the new omnibus rules. There's increased penalties. There's even a penalty for did not know. So I thought, you can always claim ignorance, but actually there's a pretty big fine just with ignorance as a label. So when you look at HIPAA, a lot of vendors will say, oh, we're HIPAA compliant. And Mike and I usually smile when we hear that, because technically no technology can be HIPAA compliant. That might sound really weird for us to say, but HIPAA compliance is only for covered entities. A covered entity is a person or an organization. So an organization, a clinician can be HIPAA compliant, but a technology itself doesn't fall under these rules. So what do they really mean when they say HIPAA compliant? Most of the time they mean that they have one or two of those 92 factors I'm pointing out there that they're abiding by that meets the HIPAA standards. So you'll notice the nuanced language in there, that this enables you to be HIPAA compliant is what some say. It doesn't mean the technology itself is HIPAA compliant, but it might have encryption, and encryption is great, but you got to look at where exactly is the data encrypted. There are several places it can be encrypted. It can be encrypted in transit, like the video we have right now could be encrypted. But once the data or the logins or whatever identifiers are before the session and after the session, that data needs to be encrypted in what they call resting state. So on the servers, on the laptops, all of that needs to be encrypted so that nobody can hack into it, or they can't accidentally see it or be exposed to it. Or if the laptop is stolen, that would be a breach, or a flash drive is stolen with that data on it, that would be a breach and a very expensive problem to have. So when you're looking at HIPAA security, you want to kind of look under the hood a little bit. If you want to email Mike or I, we can give you a document that we help make with the TRCs on HIPAA compliance and choosing HIPAA compliant vendors. That might be a good place to start, just to have some questions to ask vendors. It's hard to become a HIPAA expert, but you have people that you can call and ask more about these things. But you need to know, 3 or 4 questions to ask to really separate the ones that are really trying hard to be HIPAA compliant and the ones that are just kind of putting up a marketing message because they have encryption. Mike, did you want to add more on that particular part?
Just a brief comment in that that's great, because one of the questions I ask vendors when I'm interviewing them, I ask how they encrypt their tunnels, and I won't get into too much geek speak here, but I ask them a little bit about the internal works of their business, whether they're self-hosting their software and how that, and who has access to it. Does your video chat travel through a number of servers? And if so, in those server farms, who has access to those servers? And because they're not only points of failure sometimes, but they're also points of access for someone that shouldn't access PHI. So I ask that, and then the other thing I'll ask is, if they say we don't use servers, I'll say, well, how do you get the video to me? And often they'll say we tunnel through routers, and then I'll ask them to explain that. But that there's a lot of talk with vendors going across a wide area network. So that was my comment.
And not to paint all vendors bad. It's not that they're all bad. It's just that we need to educate people to be a savvy shopper. But there are a handful of companies that are doing this very well, and so we don't want to paint everybody with a bad brush. We just want you to be aware that the companies that are doing it well will be able to hand you a document with pretty clear specifics, and it'll be a pretty long list of things they do to protect your data and to secure their. On the slide it says administrative, physical, and technological controls. Those are 3 key areas. So, like administrative is all the policies and procedures that you have in your company that protect access to this data, and that there are penalties for that you're monitoring things, that you have a privacy officer that regularly updates people and trains your staff, that you have policy if somebody is negligent. It's whole security around the company, and that might be a little bit new to some of you in this, and this might be your opportunity to kind of step it up a notch to really secure your practice and differentiate yourself from others that are not. And then the physical, if you have a device or a computer, it can be easily owned, and I mean hacked, by a flash drive. Somebody could put a flash drive in that, and in 15 seconds they could have root access to your computer without your knowledge at any time. So you got to protect those ports and your physical location of where your server and your laptops are. And then the technological controls are pretty sophisticated, and we could talk again all day about that. But that's where you want that list to know that someone has done a good risk assessment of their practice, and they know where the holes are, and they're doing something about making sure that those vulnerabilities are covered. And just another thing to point out, that when we talk about HIPAA, we're talking about not just health information. What we think about health information, because people will say, well, HIPAA is all about health, but some of this information you may not know is protected or is vulnerable. Things like the client's zip code. If the client lives in a county or an area a zip code area that's less than 10,000, that zip code is considered protected health information all by itself. So that seems kind of bizarre, but once you get into details of how hacks occur and how computers are able to patch together who a person is and know what their health history is, and then target them for different things, you'll see that zip code is actually a pretty good indicator who somebody is in a small town. The things like that, it's good to know what those 18 identifiers are, because I've had vendors argue with me over whether or not a zip code or an email address or a patient's ID. All those things are protected health information, and you want to make sure that if a vendor doesn't know those types of things, then it's probably the wrong vendor. So just couple little litmus tests will help you identify kind of the people that are really working hard at this and the people that may not be.
No, that's a great point, Jay. I wanted to add that just what you said, not a lot, but sometimes vendors don't know what they don't know. They may have been in video conferencing for a long time, but be new to the telehealth world, and they may not understand HIPAA as well as other vendors. They learn quickly. But other point was, use the resources at the telehealth resource centers that you tie into. There's some great consultative service partners out there, and I know in our area, we're always referring. If I don't know, hey Jay, what do you know? Or right. Someone else down the line, and so there's just a wealth of information there.
Yeah, and that's a great point, Mike, because this is too much information to really know everything about. So it's not so much that you need to know everything. You need to know who knows. So Mike and I constantly reach out to each other and other experts that we know to make sure that we're covering all the bases and making sure everybody's secure and compliant, and that makes the whole organization happy and feel secure in this. Because some of starting up in telehealth is just the psychology of this, helping everybody feel like this is a good thing, this is helpful, it's effective, it's affordable. We can confidently do this in a low-risk environment, and we can help you make that case when the time is right for you. One thing I also want to point out on HIPAA is that sometimes you're dealing with a salesperson that they're doing the best they can. They don't have expertise in HIPAA. They've been given a set of talking points, and that's okay. And it's good to give them grace. Just ask for them to email you how they protect PHI, protected health information, and get those factors from them in writing. So you can let them off the hook and see if they'll produce that kind of documentation for you. And if they can't, again, that helps you sort through who's who. I wanted to go to this slide, Mike, and just talk on one more thing about HIPAA, is that sometimes people think of the easy path as to just copy after somebody else that's already doing this. They'll say, oh, well, this big hospital is using this system, so that's okay for me to use too. And what they may not understand is that this hospital using system X, their IT department did a whole lot of work to make sure that that's done a very certain way, to make sure things are protected a certain way. So just seeing that somebody else is using a certain technology may not mean that it's going to work for you, or that there are added protections that need to be put in place. So some of that is those the server protections. So let's say they use a Zoom video, for instance. I love Zoom. I use it a lot in our practice. But what we did as a company is we hosted it ourselves. And we went through a lot of different kind of configurations on our end to make sure that Zoom didn't have access to PHI. They're a great company. We love working with them. We love their software. But they disagree that some of these 18 PHI are actually PHI. And we sent them the list from Health and Human Services, and we just found that it was safer for us if we just protected all that ourselves. And so if you have a system that you like to use and you feel like, oh, we can use this ourselves, just make sure you're protecting all those endpoints. And if you're mirroring after another company, just make sure that you're also mirroring all the security protocols that they're putting in place.
Well, I had an interesting one last night. I was interviewing a company, a video company, and they sent me their yearly audits, their risk assessment audits that from an independent resource, which I thought it's the first company that's ever done that for me, and I was quite impressed.
Yeah, exactly, and those aren't things that are typically given out, so it might be that they don't give those out to everybody, but if they've given them out to you, and people can talk to you about that, I think that's really, really helpful. It's kind of a vulnerability for a company to do that, but it's also something that's confidence building that we could recommend them if they're doing that.
Absolutely.
And another part too of just the HIPAA security is we talked about the data at rest, encryption of the data at rest, the data in transit, which is while it's live, while it's moving over the internet, and then protecting access to the logins, to the computers, to the servers. Sometimes people, say, well, we have access to it, but we don't go there. We don't really look at it. What we know about HIPAA is that if you have access to it, if you have that potential, then that is a HIPAA issue. So a lot of people, will try to skirt the rules a little bit and say, well, we have access, we just don't use it. If they have access to your data at all, just the access, then they need to be under a business associate agreement. And what a BAA is, it's not a magic formula or anything. It's a word that just means contract. This specific contract has some requirements that should be in there, but when a vendor sends you their BAA, it needs to have a couple of clauses in there that help you understand that they are declaring that they are legally liable to protect the data in the same way that you are liable and have to protect the data. So they're having those administrative and technical and physical controls, and they're controlling access, and they're going to notify you if there's a breach and things like that. Those are all the things that really put them on the financial hook and legal hook to make sure that they have skin in the game to protect this just the way you would want to. Some vendors just will sign this really not understanding, the full breadth of it, or sign it and then not really secure things well. So it's still up to you to vet whether or not they're really doing their job. But it's putting it at risk if you're not vetting that. So do a little bit of homework, ask for some information from them, and see what they give you. When you're Mike, I like your recommendation on this. I'm going to let you speak to this in a second here, but when you're looking at a vendor, you want to look at that HIPAA security pretty hard, and then you want to look at the video standards, but I like the fact that Mike always asks for people to give them three demos from 3 different vendors, because you quickly see the big differences in quality and security when you compare a couple vendors across the aisle. Mike, you want to talk about the standards and
Sure.
the demos?
Yeah, and I'll also point out the link at the bottom of that slide, telehealth or telementalhealthcomparisons.com. I send folks there. It's a great site to get comparisons on video conferencing apps, and it's run, as I understand it, it's the input is by the vendors. You may know this better than I, Jay, since you're the magic behind making that work. But it's really a great site, and it's great. It's not only a good for someone new to telehealth, but it's good for the old timers, because there are vendors coming on the market every day. I will say this: when I say standards-based versus proprietary, well, everything is standards-based. FaceTime is standards-based. Skype is I'm not going to recommend them for telehealth. But when I'm talking about standards-based in the telemedicine, telehealth world, I'm talking about systems that are interoperable. The larger companies, or even some of the smaller companies, the protocols, which don't mean a lot, but they are the protocols. The legacy, it's rapidly becoming a legacy protocol, is H.323, and it's just a video conferencing protocol. And the other one that you're hearing a lot of, and this is the protocol, is SIP, which stands for Session Initiation Protocol. And with these systems, they're interoperable. So a Polycom can connect to a Cisco system, to a video, to a life size, and you can kind of keep going. And that might be wonderful, might be very nice if you're in a small practice connecting to a large hospital system that has a standards-based unit. It might make sense, it will make sense to look at that more than once, so that you can connect to them, you can connect to other providers. If you're working from your home as a provider, or a small clinic just to sites within your own organization, you can certainly go with a proprietary, like a VC or one of those companies. There's a number of them, but understand you can only connect to other systems, other VC or Zoom or DoxyB. That's just a few folks that we've thrown out there, but understand you can only connect to them. You can't connect to the interoperable standards-based systems. And then the other thing, the reason I said 3 demos, and I kind of keep this rule of thumb myself if I'm selecting something as a minimum. If you're new to telehealth and you kind of have your list of questions and you talk to these 3 vendors, what I find is by the time you get to vendor number 3, you may have some more questions for vendors 1 and 2. And it's not that you're going to spend a lot of time, but you'll learn a lot. Vendors will kind of tell on themselves as they're selling their products, and if you do at least 3, it'll put you in pretty good position to start asking the right questions to make the decision, instead of just jumping out there and making the first one. But excuse me. This slide is an example of a hybrid solution. Jay's company, Adaptive Telehealth, he mentioned that he has taken Zoom, which is a great product, and he's built his system around that. He's taken the Zoom product, and it is hybrid in the fact that you can Zoom to Zoom, but you could also, they have a connector to Zoom to other systems, some of the old legacy H.323 that I mentioned, and also the SIP system. So this hybrid system can connect to a Polycom or a Cisco or an Avizia cart or any of the other interoperables. So like at the bottom of the slide, it says it can call both institutions and direct to consumer. That's true. And there are others out there. So it's worth asking if you see that as a need in your workflow. I look at, yeah, oh, I want to make another comment, and then Jay is the expert in HIPAA high tech. He's done a lot with this, but understand that just because you have a BAA and you have password protection, you log in and the vendor says it's encrypted, that doesn't necessarily mean that you're HIPAA secure and HIPAA, or you're at least HIPAA compliant. The connection could be HIPAA secure, but there's some potential holes along that chain. And so I'm going to throw that one back to you, if you can comment, Jay, because I'd love to hear it myself.
Yeah, so again, it's good to do a risk assessment, and there's a formal document that we can send you that will have you do a risk assessment to find out kind of what the flow of the data is and where you might be vulnerable. And actually, a risk assessment is an official term and a requirement to be HIPAA compliant in an organization, or even as a single provider. So that's something that we can help you guys, on board to, and actually that's worth a whole other session right there. But we can talk through that, and then help you find there are different vendors that we would recommend. The one that I work with is Adaptive Telehealth, but there are several others that we think have some good qualities. There are some of these vendors that do not have good qualities that we also would point out. So sometimes it's working with a vendor and then adding a couple of protections on your own that would make them, meet the standards that you need as an organization. Right. So you want to talk about the kind of the warning sides here, and then we can throw it to some questions.
Yeah, absolutely. It still amazes me that I run into providers that are using FaceTime or Skype or Google Hangouts for video conferencing. There are some vendors out there that claim that they can bridge these devices securely back to any system you want, whether it's a Cisco or a Polycom. I'm not saying that they can't. It's just from what I've seen, the evidence is lacking, and I haven't done my due diligence on some of these bridging companies because I've kind of stayed away from it. I will say this: there are companies like GE Healthcare that are using Microsoft Skype for Business, and they're embedding it in some of their solutions, so it's something to look for down the road. But what I'm talking about, like in this slide, please don't sign up for the free Skype account and start doing clinical encounters. And
and Mike, to the point of GE and some of the others, there are ways to make some of these compliant, but it really depends on the setting. It depends on the workflows. It's a bit of threading a needle, to be frank. So that's why I'm not saying that all of these can be made compliant. Some of them actually can't, just by the nature of where the data is stored, who has access to it, and other factors. But some of these can be, and it's worth a consult if you want to talk through what can be and how it can be. But the rule of thumb I would look at is if it's not made for telehealth, it's probably not going to be compliant in some way. And I would say that the costs to have a HIPAA compliant system are actually not that big. So the risks, though, of having a breach, having someone, there are risks that just the average clinician isn't aware of. Like there are robots, software that scans the internet looking for vulnerabilities. And then once they get in, they scrape all your data automatically and they send it to a server and they start using that data or selling that data. These are things that or they insert a virus in your system to record what you do and send that information out and look for other vulnerabilities. So these are things that as clinicians we're too busy doing clinical work to keep track of. So it's best to really delegate a lot of security to a company that this is all they do, and they're on the hook for keeping you compliant. That way you can put some trust in them, put them on the legal hook, and then sit back and do your clinical work. There's plenty of other things that you need to focus on, and I would, as a management, from a management perspective, I would say focus on the things that only you can do, and outsource the things that you can outsource. So some of the things that a company won't do for you is business development or the politics of making sure everybody's on board, or training, creating internal policies and making sure the workflow internally works well. These are things that need more attention, whereas you can outsource some of the ongoing maintenance and the ongoing vigilance for your cybersecurity to somebody else. So we've got about 15 minutes left. Do we want to open it up for questions?
Yeah.
So as we've done in the past, if people want to write in their questions, I will share them.
And like Jay said earlier, please, if you think of something after this webinar, please shoot us an email. We'll get back to you. We'll answer your questions. Or point you to the person that can answer your questions.
I'm sending them all to you, Mike.
Yeah.
Maybe
I'll just start while we're waiting for other people. I'm just wondering if you could give us any real red flags that people should look for when they're having a conversation with a vendor. Are there things the vendor might say or do that you really see as a red flag that there's a problem?
That's a good one.
Well, I asked for use cases. I said, where's your product being used? Can you, what systems, who are your customers? Can you share that with me? And sometimes that's not fair to the folks that have just started, but they'll mature, hopefully.
Well, and you're asking about specific people, right? Like references?
Yes, I'll ask for customers, but I'll also if there are red flags, the first red flag would be if the company does not offer a BAA. If they don't offer a BAA, that tells me a lot right there, because usually the next comment, why don't you offer a BAA? And they'll say, because we're not a covered entity and we don't need it.
Yes,
and
which is technically true, right?
Yep.
They are not a covered entity and they don't need it. However, you are a covered entity as a clinician, and you do need it, and you need them to give it to you. So that would be like, yeah, number one requirement. And you're going to have some vendors try to talk you out of it. Oh, you don't really need this, because they don't want to be on the legal hook for it. So yeah, I would make that. Yeah, I agree with you, Mike. I'd make that essential. The second red flag I would look for is, asking about what do you do to protect the PHI, or what. Actually, I ask, what PHI do you protect? And they just say, oh, we have protection. Oh, we have encryption, and they can't name, half of the 18 indicators of protected health information. That would tell me that either the salesperson or the company doesn't know, what is required for HIPAA to secure you. So if they can't pass these kind of little information tests, if you will, then I would just move on.
Yeah.
Great. All right, so we have another question. Do you know of any cases that are previous or current under litigation for not using a HIPAA certified solution or a telemedicine data breach?
Oh, that's a good one. There's a HIPAA wall of shame. That they don't call it the wall of shame, but there's a report that comes out every month that is a long list of people that are getting fined for data breaches, and it's in the tens of thousands to millions. So you see some of these on the news, like maybe an Aetna or Cigna or something like that. That's like state of South Carolina, the entire state got breached. But these are publicly disclosed, and they are actually increasing as I can see. So there are quite a few out there. So in terms of litigation, a lot of these things are settled privately. They're either a fine from Health and Human Services. I'm not aware of any class actions or anything like that. I will say that it is very easy to have an audit started on you. It's actually just a little web form that a disgruntled client can fill out to start an audit. And an audit by itself is very expensive. A breach is also very expensive in that one of the penalties for the breach, if you don't have everyone's updated information, you have to publicly put that on your website for 3 months that you have been hacked. And you have to also state it in the local media in your area. So on television or in newspapers, and it's all at your expense. So the expense for a breach or non-compliance is rather high. And the cost of becoming compliant is actually not very high. So when I look at the cost benefit ratio, I think it behooves us to try to be compliant as we can.
Yeah. Are either of you aware of specific examples of telehealth breaches?
I believe there are some listed on the HHS's website. I can't just off the top of my head, but I know that there have been some.
Yeah.
And it could have like really nothing to do with telehealth specifically, because really, as Mike and I talk a lot about this, that telehealth is just healthcare delivered through this mode of technology. So the services aren't any different. It's just there's different protocols around it to keep it secure and ethical and have a good presentation. So if there wasn't great data security before you started telehealth, telehealth just may highlight that lack of security. So it may have very little to do with the actual telehealth encounter. It just might have to do with the company in general.
Right. Someone had a question, which I'm going to read. I'm not entirely sure I understand what they're asking, but let's see what we can do. Could you expand on tech check recommendations and consumer tech requirements? So I think what they're asking about is solutions that would allow for services to be provided to patients at home, and sort of how do you find those systems where it's consumer friendly for DTC services?
I think that's awesome. You know what? I'm going to go to my next slide, Mike.
Okay.
Because it has that on there specifically. Mike, do you want to talk a little bit about that first, and I can jump in?
Sure. There are a couple of ways. I know often with remote patient monitoring video, often the device is controlled by the company or the provider. Say it's an iPad, and that device is handed out to the consumer or the customer in the home setting, and once they get it back, it's scrubbed and ready to go to the next customer. But there's a couple of other things you need to know. That's from the device side, but what kind of connectivity do they have in the client's home? Is there a quick test? And with iPads you can do some speed checks and things, and you can do that remotely. You can set up the or work with the client to do that. But and I'm just going back to remote patient monitoring a little bit, and a lot of that's stored and forward. But I know in rural Southwest Virginia, there's still a lot of dial-up connections, and so that doesn't fare well for real-time video conferencing.
Yeah, it really depends on the service that you're requiring or you're providing. But there are a couple of things that we can easily talk about my end of things is more on that direct consumer end, and working with those consumers. The first thing I would look at is the vendor that you have. Is it easy to use? Their software and technology, is it easy to use and install? And then the second thing is, from that you would want to have some minimum requirements, and this is what it takes to use our services, and make that very clear. And you're going to have certain computer types and software types on those computers to make sure that they have what's necessary. I've worked with consumers, and I remember doing a tech check, and somebody calling me in to do a tech check with a company or a client, and come to find out after like 25 minutes we realized this person didn't have a webcam. No wonder we can't see him. He didn't even have a camera installed, so we couldn't connect to it. But some of those logical things actually happened with a psychiatrist I was working with just not too long ago. Showed up a couple different times to our meetings with a computer that didn't have different computers didn't have a camera. So there's just some ignorance there that we have to be very explicit on here, the things that we need. The second thing I recommend is doing a quick phone call with the end user. It could be like an admin staff or someone that just a quick warm phone call to make sure that they have these things, have them shut down everything on the computer, and turn off everything. That's the biggest thing. They're usually multitasking. So have them shut down everything before they go to that site that you need or the install things, and then kind of walk them through the setup. And it might be overkill the first time, but I think it'll ensure a really good relationship and ensure a good encounter with the person initially. So that little bit of cost up front will ensure a good kind of follow-up and a good reputation with the service. So people feel like, oh, it's easy to do. I can easily connect. So you may not need it 9 out of 10 times, but I can tell you that 10th time, when you do need it, will cost you a lot of time and aggravation and reputation. So in my experience, it's been worth it to do those little calls up front.
Yeah, and I try to train people to dial in early. That's one of the big deals for me. I'll have them dial in ahead of time. And I if I go to my primary care physician's office, I'm supposed to get there 15 minutes ahead of time to sign, to update my insurance. And so I kind of try to instill that in the consumers as well.
Exactly.
Yeah. All right, we've got one more question here. What type of telehealth training sessions are available? Clinical, technical, presenter? Where are these being offered?
A good question. There's a couple different ones out there. I've just helped the Center for Credentialing and Education create a series for telemental health providers, and I can send you some links to that. I didn't have them prepared here today, but if you send me an email, I can send you a link to those. And those are all online, asynchronous, take it your own pace. I know there are a couple of telehealth 101 courses, but we can, Mike, we can make a comprehensive list and give that to them. I know Star Telehealth does quite a few. Do you want to add more to that?
I can just say Star Telehealth does a Telehealth 101. That's STAR stands for the Southside Telehealth Training and Resource Center. It's in Martinsville, Virginia. They do HIPAA training, stroke training, and the Telehealth 101 is for, I'm backing up a little bit, but they have online and a hands-on workshop for a telehealth presenter and a telehealth coordinator, depending on whether your role is an admin function or clinician function. And I know they're expanding that program. And there are others out there.
And we could put together trainings for for an organization if they need certain types of training or at a certain time.
Yeah.
Yeah, and I'll just add that our next webinar is actually on telegenetics training, so there is some specific training that's being put together that is usually a little bit of in-person training combined with a bunch of online training that is specific to telehealth and genetics, and that's what the webinar is on next month. So it's sort of a timely question. We'll definitely, we know that's important and we're getting there.
Excellent.
All right. Well, Jane, Mike, thank you so much for your time today. This was really helpful as we start to think about how to approach these discussions about technology. As a reminder to everyone, the recorded webinar, the slides, and the meeting notes will be posted in Basecamp, and as I said, the next webinar will be on training. Feel free to contact me with any questions, and thank you all so much for joining us.
Super. Thank you.
Thank you.